Hello friends, myself Dr. Vaibhav Agarkar, a practicing dentist at Yotmal, and very welcome to my channel, that is the Perfect Dental Clinic Interiors. I am very happy that you are seeing this video. That means you have already seen my previous uploaded videos. Okay. The Perfect Dental Clinic Interiors, really what it means we have explained it before, but it's a platform which discuss to create a dental clinic that is really fitting within the limits of time, space and money, and really very effective for the dental team to deliver the best treatment to the patients. So hence today in my channel I am going to discuss about space planning. If you have seen my previous video, that was specially designed for the space planning for the dental clinic for 200 to 300 square feet areas, and today I am going to provide this video which is specially designed for 300 to 400 square feet areas. This area, what we the video completely is based on one of my friends clinic space planning, who was having approximately 380 square feet of area, and now we are going to see it's his own place. It was almost 13.7 into 28 feet space planning. It was on the first floor. It's a own property. Expected two separate cabins, as those were the husband and wife dentist, and they want their own. And I will say it's a permanent dental clinic he want to set up. A dream clinic we may consider it for every dentist, with a good waiting room, a proper consultation area, good sterilization, storage space, and everything. And hence, now let's think how we may plan this for anyone having 300 to 400 square feet area. Thanks. Let's first see how we may slightly divide our area in different parts, different important parts of our space planning. This is the basic distribution of the space I want to show here. In my that friend's clinic, there was stairs from one side of the entrance. So we may see here this area what I am showing about. This is the entrance, the stairs. Those may have approximately 4 square feet of width, 4 feet of width, and almost the length may be 7.7 feet, and it enters into the area which is, yeah, we know as a waiting room. So this is clearly a waiting room. This complete area we may use as a waiting room. We may extend up to this, the same waiting room. So the basic need what we need is the waiting room firstly. Then, as we already know that we want two separate cabins, so we consider the further remaining area as a two separate cabins with two different chairs. And luckily my doctor friend was having a slight extra area at these two corners. Okay, so the sterilization part may be covered, even though that extra part that was about 4 feet by 4 feet extra part was attached. So we have not included that sterilization area or the storage area here. The storage is maximally covered when we will show actually the wall part or the furniture part from the view. mm, Apart from the basic space planning, we will consider that in a different video, because it's actually having more complicated part than the top view. Okay, so let's think about the space planning only. So this was the first basic distribution of the space, that is the one entrance, as we say, the entrance, the waiting room, then The waiting room may be divided in slightly less or more area as per the need. Then two working chairs. And that's slightly, as we say, we have slightly make it clear that we need a slight less waiting area, so we may include a special consultation area here. So in this one we have one waiting room, one special consultation area, two different chairs. Okay, as this is the need of the treatment plans we have included, the modern treatment plans, which may be as an implant or the full mouth rehabilitation, which really need a good consultation time and good consultation ambience, and really the every steps should be clear in the mind of the patients before the treatment. That needs a consultation time, dedicated consultation time, and hence we may need a special ambience for that consultation. So we have this special consultation area here. Now let's go towards the first space planning we have made for that 380 square feet of area with the best of all the golden rules. Now the golden rule point, as we have already discussed before, the last video, the one of the golden rule I had discussed there, that the dental chair or the patient's face should never be facing any door or the distracting areas to disturb their attendance. So that was all, and any further golden rules what we are going to discuss in the next videos also, those all are incorporated in this, the space planning what you have done here. And this space planning is very easy to understand. Let's discuss about it. So firstly, we know the stairs we have shown here, we have considered to be maximally 4 feet of width, and as it enters we have a good spacious waiting room with very easily those may have a very rich looking, good looking waiting room arrangements, sitting arrangements. Also the waiting room is really very important space. The every minute the patient, our patient, be in the waiting room, that's the golden time we may utilize to describe ourselves or to fit our specialties in their mind. So here we have specially provided a good waiting room area for the accommodation of the patients. After that we have made two separate cabins for both of the fully working dental chair arrangements, as both of the dentists they want to work at the same time. These all are fully functional waiting rooms, sorry, the working cabins. Here both are having a special consultation tables with special working tables and a good spacious arrangement from the wall to the working table, for even though the attendant should have a special comfortable space to work there, that all is kept in mind, and we have kept all those markings here. As you may see, the all markings are done here, so you may consider this, this is calibrated, this complete planning is calibrated as 1 centimeter as to 1 feet, and hence any what the here is completely proportional to the space planning at the actual space. So now we will slightly understand what are the distributions what we should have if anyone is going to plan their own area. So for the 300 to 400 square feet area, they may easily apply this plan to their space with the space distribution. As you are seeing, the width what we were having at the waiting room at the starting was 6, and that means it's slightly compromised as it's only 6 feet. 6 feet is not a very good width, but we have very good width here. It's completely 13.3 feet. It's much more than the minimum. Okay, so the 13.3 into how much is the day here one, so we have provided totally 12. These are 12 feet. That means it's a much good waiting room. We are waiting space you have provided. You may put very good ambience here for the entertainment also. It may be for our the representation, which include our different different programs we have carried out, the different prizes we have got, or the certificates we have got in the TV or the videographic show of the our cases we have done before, or what or the other treatments we have to emphasize on. So this waiting room is actually very well to do all the things or to utilize all the modern equipments, information brochures and so on in this area. Next, in the working area, what we have to discuss about is firstly the chair. What do the space a chair need? It needs approximately 6 to 7 feet. We may consider it to be a 7 feet. So we need approximately 7 feet of width and almost 7 feet of height. So we have it. If you are if you may see this video slightly magnify or just try to understand this, it's actually calibrated. So it's 7 by 7 for every chair, as we have provided 8 feet of width for this cabin. After providing 1.5 feet to 2 feet of this working table, we have 6 feet at here, and where actually we work, that's the space here, we have completely almost 7 feet of width. After that, the working table and space for the persons to come in or to settle down or to go to the second bed, that's we have already kept out of the reach of the patients or out of the reach of the patient's sight. Here we may the sitting arrangement for the two of the parents of the patients is also very well done, and the second chair is actually the same arrangement as that of the first chair we did, and both of the cabins are really very nearer to each other, just a partition in between. So the attendants may easily help us in both of the chair, on both of the chair. So it's handy, such as the few instruments such as the uh, RVG sensor or a portable X-ray machine. Those may be easily carried out from one chair to another, and hence it's work efficient. So this arrangement of chairs, the cabin and the waiting room is a very good one in this space planning, according to me. Next try for the second one, the second planning. That's my plan 2. Firstly, I want to say this is the best lovely space planning, I think, according to me. And as I discussed with my 2 to 3 more dentist friends, they really like this plan as the best one. So let's discuss about this. Now, what's the difference we made than the previous plan? That the stairs parts is already fixed. The consultation area, we have included a new part, that is the consultation area. Just let's see, we have incorporated a consultation area, a special, I will just highlight it. We have made a special consultation area here, and for that we have compromised our waiting room, but I will say we have not so much compromise it. The waiting room will fulfill their its minimum requirements here also, and hence waiting room all is almost the same efficient, only the space will be the less, but the efficiency will be the same, and the other chair arrangements are really the same, only the working table, just beside the working table, now there is no consultation area here, because the consultation area is specially made here. special consultation area. And this consultation area really having the sitting arrangements for the two doctors to consult, and the patients and the accompanying person here. Because the mostly we expect the we expect the special consultation time and everything for the longer treatments, and there we need to explain the treatment to the patients and even though the accompanying person, so that need this spacious arrangement. So here we have made it with 9 feet of width and almost 6 6 feet of length. Here a good working table we have provided and everything. As you may see the different dimensions here clearly, so I am not going to explain every dimension because those are written and really easily can be understood to you. And really I like this consultation area incorporated, especially because this is the need of the time now. And next go, we have made a very slight changes and the further planning this one. Here also we have a very good consultation area, very good waiting room, spacious. Just we have made slight changes with the chair arrangements. This is also a good one arrangement because due to the chair arrangements here we have various very spacious arrangement here for few surgical works, because slightly such as we are saying about the implant, and so we need to arrange few extra instruments around. So here some extra space we have incorporated around. So I will say this is also a good special arrangement. If someone don't like the previous arrangement, he may go for this arrangement. And accordingly we have to change the working table, because as the chairs dimension will change, chairs arrangement directions will change, working table should accompany accordingly. So these are the changes with the working table and the chair directions. So the plan number 2, and now the further this plan is really my lovely plan. Let's go once just to show you my last plan, which was in my beloved plan. This is my very beloved plan for that almost 380 square feet of area. And that's all. Thanks a lot for watching my video completely perfect dental clinic interiors. We will see further more details in further videos. Thanks a lot.